Alright guys, this is my poster on polycystic renal disease. Polycystic renal disease is a genetic disease. There's two different forms based on the way you inherit the disease. There's infantile autosomal recessive and adult autosomal dominant. Autosomal recessive polycystic kidney disease or infantile polycystic kidney disease is more rare because it's a recessive trait, so both parents must carry the gene in order to pass on the disease. The gene that determines if the disease will be present or not is on chromosome 6. There are 4 different forms. There's prenatal, neonatal, infantile, and juvenile. They're assigned based on the patient's age and the symptoms that are present. 23 to 30% of infants with autosomal recessive polycystic kidney disease will die hours or days after that they're born, rather from kidney failure or breathing difficulties. It's common for these patients to also present with like an enlarged liver. Autosomal dominant polycystic kidney disease or adult polycystic renal disease. It's much more common than the recessive form. It occurs in 1 of 800 live births and accounts for 90% of polycystic renal disease. Because it's a dominant trait, only one parent has to have the gene in order to pass it on. There are 2 different genotypes that determine the severity of the disease. ADPKD1, which is autosomal dominant polycystic kidney disease 1, and ADPKD2. The first form is found on chromosome 16, and it's a lot more common, and it's a more severe effect on the kidneys. The second form is found on the 4th chromosome, and it has a later onset of symptoms and a much slower rate of progression into renal failure. So these patients typically have a lot longer life expectancy than the other forms. Always be thorough and check the abdomen and other locations if you do see that multicystic appearance on the kidneys, because the patient may also present with cysts on the liver, spleen, pancreas, thyroid, ovaries, testes, and breasts. Patient may also present with cerebral saccular aneurysms and abdominal aortic aneurysms. Some signs and symptoms. They may be asymptomatic, especially with the second form of the autosomal dominant, because they might be in their 50s or 60s before symptoms even present. So hypertension, high blood pressure, back or flank pain, headache, increase in the size of your abdomen because of those enlarged kidneys, hematuria, blood in the urine, frequent urination, kidney stones, kidney failure, urinary tract or kidney infections, palpable mass, rupture of a cyst, renal obstruction. It's all going to cause pain, the rupture of a cyst. So let's see. Sonographically, there isn't much distinction between the recessive and dominant forms. The best way to diagnose and differentiate which form is present in the patient is just getting a really good patient history and tissue sampling or biopsy. In an adult, we should see bilateral enlargement of the kidneys with multiple cysts of varying sizes, both in the cortex and the medulla. When severe, kidneys can lose their shape, become hemorrhagic, have calcified walls, or even stones. In a prenatal sonogram, you'll see oligohydramnios, so not enough amniotic fluid, hypoplastic lungs, underdeveloped lungs, enlarged kidneys due to multiple cysts, and it can ultimately result in renal failure or fetal demise. Over here are some images. The first one I have is an OB scan of an autosomal recessive polycystic kidney disease. Fetus presents with oligohydramnios, enlarged epigenic kidneys, hypoplastic lungs. The baby was delivered at 37 weeks and died just a few hours later. So here, I'm just going to rip this off so y'all can see this. I'm not really worried about the poster. So, you can see these are your 2 kidneys, and it takes up the entire fetal abdomen pretty much. So, yeah, definitely renal failure. Okay. this next image I have is a autosomal dominant polycystic disease. It's the longitudinal right kidney. This one's in an adult. And you can just see that there's just so many cysts, different sizes. You can't differentiate the sinus from the cortex. It's just a mess. Okay. Let's see, and some different tests that you can use to diagnose. Ultrasound's definitely a really good modality, CT and MRI. My references, I just used the Hagen Answer book, and I used the Mayo Clinic website, and I used this really cool article. It was like a published article online. So that's it, guys. Thank you.